This example shows a malpositioned IVC filter and shows how it progresses over time. So this is a CT initially acquired after the placement of IVC filter, and this vessel that is opacified is aorta, and this vessel is inferior vena cava where the IVC filter is placed. So IVC filter has these struts. One of these struts is extending beyond the wall of the IVC and extending up to the margin of the aorta, not completely penetrating on this initial exam. And if you look at the coronal images, we can see one of the strut is touching the wall of the abdominal aorta, but is not penetrating it. And another interesting finding in this particular case is if you look at the liver bone windows, we can see one of the struts posteriorly is extending into the vertebral body. This can be better seen on the SAG images on bone window. So here we can see there's a posterior strut that extends into the anterior aspect of the L3 vertebral body. There is this lucency around the strut, and there is reactive bone formation, reactive sclerosis, where the strut has entered the vertebral body. So the patient came back for a follow-up CT. The patient is asymptomatic, and the follow-up CT was done approximately a year later. And on this follow-up CT, we can see the positioning has worsened, and one of the struts that was extending into the abdominal aorta, this is the aorta, and this is the IVC. It has extended further deeper into the aorta, and this can also be better seen on the coronal images on the most recent study. And on the coronal images, as we scroll down, one of the strut is now extending slightly deeper into the abdominal aorta right here. Now bringing our attention to the posterior strut that was extending into the vertebral body, there is again this lucency along the track of the extension of the strut into the vertebral body, and there is this reactive sclerosis around it. And if we look at the SAG images on the most recent study, we see the strut has further progressed deeper into the vertebral body here with progressive reactive sclerosis around the track of the extension of the strut into the vertebral body. So the stent is progressively worsening in position. And if you look at the coronal image, we can see the hook of the stent is still within the lumen. So typically what can be done is this can be accessed, and from the top of the hook, the stent can be pulled up a little bit and repositioned for appropriate positioning. So this is an example of malpositioned IVC stent with one of the strut extending into the aorta and the other strut is extending posteriorly into the L3 vertebral body. Thank you.